Assalamu alaikum, Iyakan Abdu wa Iyakan Astain. So, from today onwards, I'm gonna start the surgical portion of SK18. So, let's start with surgery 19th Feb afternoon paper. Question number 1: the good pasture show which type of hypersensitivity? Type 2: organisms mostly present in surgery of abdomen and urogenital tract surgery are the Bacteroides fragilis. The sailor man presented with the fever, rash on elbow, and the generalized cervical lymphadenopathy with the TLC raised TLC of 70 to 30. What is the suitable diagnosis? That is the infectious mononucleosis. The ectopic thyroid hormone is secreted by the squamous cell carcinoma of the larynx. The cerebral blood flow at the rest is 54 ml slash 100 mg per minute. Treatment of MRSA is the vancomycin. The diabetic patient present the OP, the oozing greenish discharge that is going to be pseudomonas. The liver is held in the upper part of abdominal cavity by the attachment of hepatic veins to the inferior vena cava. The patient present with the boil on the labia majora, which the following is the lymphatic drainage, the medial group of the superficial inguinal lymph node. The way while taking graft of the rectus abdominis, there is a damage in the suprapubic area. There is a risk of damage to which artery? That is the inferior epigastric artery. The baby after an obstructed delivery present the inability to adduct the arm, loss of flexion, loss of supination of the arm at the elbow joint due to the damage of the Erb's palsy. Which of the following is not attached to the greater trochanter? That is the gluteus maximus. The 60-year-old develop pain in the calf muscles after walking 100 yards. Pain is due to the popliteal artery. In third degree UV prolapse ligament damage is the uterosacral ligament. Regarding breast, 15 to 20 lactiferous ducts. Next, with exception of sweat glands, parasympathetic system cause what? That is promotes secretion. Rectus sheet above the area of something is formed by the external internal aponeurosis. Next, the patient diagnosed the hypertension, treated the diuretic. Few months later present with the big toe swelling. That is definitely going to be the thiazide diuretic in the hyperuricemia. Next, our lengthy scenario and it is the nephrocalcinosis. Next, the auto regulation of the GFR is by efferent arterial constriction. Before deciding for the transplant, measure of renal function is done by the creatinine increase. The patient presented the fever, diarrhea, platelets, and the bloody diarrhea. Peripheral film shows schistocytes, that is the HUS. Next, the child presented with the dark red nappy, dark urine, and hemogenistate oxidase deficiency. That is alkaptonuria. The patient presented with the epistaxis and menorrhagia. Lab showed bleeding time of 14 minutes, ability 60, and the PT 15-second pH normal. The diagnosis is the 1 million. The patient has the anemia and the hypersegment neutrophils are present in the peripheral blood examination. He is also having difficulty in the balance with type of the anemia. He is suffering from the beta 12 deficiency. The female during the delivery loses the blood and requires blood. Her blood sample is reactive blood agglutinates with anti-sera B and the anti-sera D. Which blood usable for the transfusion? B positive. The Turner syndrome karyotype is 45x nullo. In related state, actin bind to which of the following protein? That is the tropomyosin. The tumor marker for the variant CA is CA125. An old patient presents with an enlarged prostate in the marked in the PSA. MRI done and bone metastasis observed. Which is the root of the spread of prostate to the vertebra? That would be the vertebral venous plexus. Next, the cervical carcinoma differs from the benign lesion. The invasion of the basement membrane. Oropharyngeal carcinoma caused by which organism? That is the HPV. Next, sentinel biopsy of exit lymph node in a suspected breast cancer is done to avoid the axillary dissection. The person got stabbed on the upper arm and the floor of axilla. Which of the following structure will be damaged? That is the intercostobranchial artery. The Graves' disease exophthalmos is due to the increased TSI. The site of the murmur for the aortic regurgitation is right second intercostal space. Increased precipitation of carbon dioxide will cause the tachycardia. Which of the following pressure measured between the venous and the arterial side when heart is stopped? As the measured systemic filling pressure in the last trimester of pregnancy, which causes the respiratory parameter occurs as the decrease FEV1 into FVC. EDV depends on venous done. The ligamentum flavum connects the lamina. The sodium active reabsorption is in the colon. The peptic ulcer pain is carried by the greater splanchnic nerve. The mechanism of action of NSAID is that they basically inhibit the arachidonic acid. The aspirin at the lower doses inhibit which of the following? Inhibit thromboxane A2. At which vertebral level does the renal artery typically enter the hilum of the kidney? That is L1, L2. Pancreatic injury secretion goes into which of the following: the laser sac, the person is having the history of smoking and drinking from the many years on endoscopy, there is a mass in the middle third of esophagus, what could it be likely? That is gonna be the squamous cell carcinoma. The old patient presented the emergency room for the fatigue, etc., etc. That is going to be anemia of the chronic disease. Next, the cholesterol gallstones may be resolved by the oral treatment with the deoxycholic acid. Patient has an anti-HBC, IgG positive, and anti-HBS negative, anti-HB negative, HBC and HBeAg negative. This is the past exposure. The patient had the cough and X-ray shows the hilar lymphadenopathy, non-casitating granuloma, hypercalcemia. The diagnosis would, in this case, would be the sarcoidosis. Most common cause of the granuloma with the suppuration is the nocardia. After cut in the skin, bacteria enter and cause inflammation by the active complement. A person having knife injury to the finger, first mediated lease will be the histamine. The patient with the epicanthal folds, retardation, protrusive abdomen. What is the diagnosis of chromosomal abnormality? That is the trisomy Down syndrome. The emboli in the venous circulation will lodge in the lungs. Myasthenia gravis is due to IgG. As a 50-year-old hypertensive patient presenting the severe pain radiating towards the back, suddenly collapse. On autopsy, what could be seen? There is a medial necrosis. Next, the IVC begins at the L5. The parotid surgery, facial nerve cut, muscle affected would be the buccinator. The thyroid gland moves during the swelling due to the pretracheal fascia. Herniation causes loss of ankle reflux. The following is the root value of the ankle jerk, that is the S1. The lateral side of the foot is supplied by the beta, which is the S1. Next, the Aspergillus and the Staph aureus recurrent infection. What immune disease? There is a NADPH oxidase deficiency. The best block in which drug concentration is the highest in the blood, that is the intercostal block. Which of the following tract characterization of the crude touch sensations? This is the anterior spinothalamic tract. The mother brings her child with a complaint that her child has visual problems at night. What is the responsible for the night blindness? That is the retinol. The most important cell for the secondary intention healing is the myofibroblast. The primary immune system organ, V T and beta lymphocytes are formed and mature in which of the following? That is definitely going to be the bone marrow and the thymus. Next, in HIV patient, surgery done, which antiseptic is used to clean the floor after the surgery? That would be 1% hypochlorite. Next, the ventricular filling, in which ECG segment there is the TP. The post-influenza infection, thick yellow sputum present due to the Staph aureus. The child develops the night blindness and presented the pediatrician. Which one should be given to the patient? That is the retinaldehyde. The carbonic anhydrase is present in the cytoplasm of RBC. The ridges associated with the verrucous carcinoma. Next, the patient climbed a peak with a heavy bag on his shoulder. After that, he developed loss of erection of arm, loss of flexion of the elbow, loss of extension of the wrist. Most likely damage occurred to which of the following? There is upper part of the brachial plexus. The patient has the difficulty from sitting to standing position. Which muscle would likely be injured? That is the gluteus maximus. The female hernia neck of the sac lies below and the lateral to the pubic tubercle. Twin pregnancy with the womb, which is correct? That is the separate amniotic sacs. The lymphatic obstruction is caused by the inflammation and the fibrosis. 1 billion disease, BT and the PTT derange. The problem would be in this case the platelet adhesion. Next, the intervention before occurring disease. Leon is the primary prevention. The colleague complaining of things like that, and this is gonna be the urine screening for the toxicology. Basically he has taken some sort of drug. The sequence predisposed thrombus formation would be enthelial injury, blood stasis, blood constituents change. And next, the transmigration of the neutrophils along the strong endothelium would be the diapedesis. The correct sequence of events for the neutrophil migration toward the site of the illness would be that is the margination, rolling adhesion, and transmigration. Highland disease, most important etiology is the premature tissue unable to use oxygen due to the cyanide poisoning. The patient known case of the hypertension was prescribed hypertensive, present few months with the complaints of burning and tingling sensation of feet and has a high glucose level. This is the thiazide. The patient has the decreased eosinophils and lymphocyte. With therapy he is taking the corticosteroids. The renal blood flow is regulated by the tubuloglomerular mechanisms. Next, the damage in the hydrocephalus is prevented by the endothelial cells. The lower esophagogastric junction and the fundus removed, what will happen? Loss of the receptive relaxation. The patient with ethanol poisoning, what will then and gap if sodium is this one, chloride is this one, that is gonna be the 30. Which one the following used to calculate the total body water? That is the heavy water. Next, the Christmas disease, increased bleeding, what will be raised? That is APTT, the congenital erythropoietic porphyria. What is the finding in the urine? That is increased urine due to porphyrin 1. Which of the following is the qualitative change in the gene expression? That is the Boyne mutation. The female with the oligomenorrhea karyotype 46XX and 245X null associated feature would be the gonadal degenesis. Hereditary spherocytosis, defective protein is the spectrum. Which of the following is translocation is seen in the CML, that is the T9:22. African woman with the raised AFP, the cause of the primary hepatic carcinoma is in the aflatoxin 1 in the diet. The histopathological slide made after right lobectomy and the ischemosectomy for facility thyroid nodule shows the cell balls and the amyloid deposits and the foci of C cell hyperplasia. Most likely the diagnosis is the medullary carcinoma. The growth hormone needed for the proper function would be the insulin. The risk factor of the cancer, skin cancer, is the xeroderma pigmentosa. Standard deviation measures are the variability among the individuals. Values in the neuroleptic analgesia is by the droperidol and with the fentanyl. The glial fibrillary acid protein positive in the astrocytomas. The grading of the carcinoma is for nuclear morphology. Next, which of the following nerve is damaged during the surgery of the lower pole of the thyroid? That is the regranulogen nerve. The eosinophilia in apoptotic cell is due to the which of the following loss of cytoplasmic in a person running in the marathon race? Blood flow to the non-exercising muscle is by the postganglionic sympathetic cholinergic. The regarding myelinated fibers, true would be action potential at the internodes. The decreased potassium level will be indicated on the ECG by the inverted T waves. The patient with the transmembrane fog died on the 9th day. Cause would be the pericardial tamponade about the cardiac plexus. The contain both sympathetic and parasympathetic fibers. The patient presented with the shortness of breath, scratchy sound with the no change the respiration. On echocardiography, pericardiophagia is noted. Which of the following is best side to remove the flood? That is the subcostal with the needle angle superiorly. Main renal artery enters hilum at which level? That is L1, L2. Small amount of the blood loss for long period of time with low MCV leads to the microcytic hypochromic. The patient with alcoholic hepatitis with the medullary body is interwoven structure is the intermediate filaments. The 55-year-old male alcoholic presents with the symptoms of the liver disease and is found to have the mildly elevated liver enzymes. The liver biopsy examined with the routine hematoxylin and eosin stain reveals abnormal clear space in the cytoplasm of most of hepatocyte. Which of the following is the most likely cause? That is the steatosis. Next, the PT is used for the following, that is jaundice. The feature of the acid fast bacilli in the TB is the mycolic acids. Student examining staining which shows the gram positive coca in the chain. Many attempts made but cannot be cultured. Which other technique can be used in this case? That is the serology. Sulfur granules contain the bacteria is the actinomyces. On microscopy, the lymph node biopsy specimens granules which cause the necrosis found the diagnosis the TB, that is the demonstration of AFP. Next, the trally occurs in the trally or trolley whatever that occurs after the 6 hours. Next, the embolus in one of the branches of the pulmonary artery causes the increase VQ. Which part of the intestine thick will be less mesentery fat and vasorecta sugenas for the uplifting during the surgery? That is the jejunum. Next, this one, the fibers of the corticospinal tract are decreased in the medulla. Elderly obese man with a severe atherosclerosis developed acute abdominal pain. Laparoscopy, small intestine was the dark purple in the color. Superior mesenteric artery was atherosclerotic and thrombosed. Mesenteric vein patent. The small intestine pathology will be called as wet gangrene. Next, the trigeminal ganglion location is the apex of the petrous part of the temporal bone. Furunculosis in the tip of the nose separated the cavernous sinus via the ophthalmic vein. The patient having the vesicles on the lateral forehead and the medial side of eye and of the nose with a severe facial pain and headache. Which nerve is involved? That is the maxillary division of the trigeminal nerve. If accommodation remains intact and light reflex is absent, which will be damage? There is a P tactile area. Next, the patient has internal capsule lean, the posterior Babinski sign. What else will you find? That is the pendular knee jerk. CSF absorption occurs at the subarachnoid space. First branch of abdominal aorta would be the the celiac trunk. The patient presented in the semi-conscious condition with subclavian steal syndrome. Blood supply to which artery is causing this condition? That must be the vertebral artery. The patient was operated for the abscess in the posterior triangle of neck. Now cannot raise her arm overhead. What nerve is damaged? The spinal part of fixation. The patient has the microtia and the maldevelopment of external auditory canal due to the defect in the first and second branchial arch. Next, the tertiary villus contains the fetal vessel. The patient with the Addison disease presented emergency with the which complication? The hyperkalemic paralysis. The force expiration mainly through the internal intercostals. The young man sustained RT with the multiple fractures, has difficulty in breathing. Notice this is moving more during the breathing, which muscle help him in the breathing, that is the external oblique. The patient after trauma muscle of abdomen, the paralyzed still breathing level injury occur, that is the below C5. Which of the following organ is responsible for the pharyngeal abscess formation? That is group A, streptococcus. Which of the following cell is not normally present in the pancreas? That is the mucous cells. Which of the following substance is more concentrated at the proximal convoluted tubule that is gonna be the creatinine. The most important regulator of the insulin is, that is Charlie, which is the glucose. Next, the not given only because of the highly phosphosphorin activation by the liver is the adrenaline. Nutritional status can be assessed through the albumin and the TABC. The patients during the RTS sustained sacral injury presented with the overflow incontinence. What is the lesion? That is the parasympathetic. Stage 4 cervical CA. Lymphatic drainage is in the internal iliac. The 60-year-old male presenting the OPD the complaints of hematuria and increased unique frequency on the DRE. The registering hard mass felt is a prostate lymphatic drainage of the internal iliac and the sacral. Informed consent is important because it provides the participant with all information regarding risk, benefits and alternatives. If the temperature of the set point increase, then there will be decrease in the sweating. Most medial branch of the external carotid artery is ascending pharyngeal. The blood taken from the blood bank, within how much time blood should be transfused? That is the 30 minutes. The female presented with incisional hernia. Which layer comes first after skin and subcutaneous tissue? The transversalis fascia. The special feature of the cardiac muscle is extract 70 to 80% oxygen from the blood. The rest in healthy man, metabolic requirements may exceed the oxygen supply in which, that is the skeletal muscle. Next, the regarding melatonin, true is the derived from the serotonin. The amputation of the limb pain is due to the phantom limb. The woman with the hyperthyroid feature with a goiter diagnosed certain deficiency. Cause of the deficiency is the improper diet. The neurotransmitter in the slow wave sleep would be the serotonin. Next, the patient presented condition after multiple soft tissue injuries. The cause of shock in this case with the peripheral vasodilation in submandibular, something which structure along the lingual nerve is present. There is a facial nerve. Next, multiple drug resistant, we can go for the ethionamide. Injury the ulnar nerve in the medial epicondyle is due to the last sensation in the medial aspect of palm and the dorsal aspect. Uncontrolled mitosis, the typical nuclei is associated with the neoplasia. Next, the right atrium infarction involve which of the following? The pectinate muscle. When light is reflected in the right eye, light reflex is absent in both eyes. When it's reflected in the left eye, light reflex present in the both eyes. It is due to the Edinger-Westphal nucleus. The autoantibodies against the parietal cells occur in the pernicious anemia. The engineer working the constriction present with the pleural plaque. FVC decrease in the FVC into FVC. Normal diagnosis would be the asbestosis. The cardiac lung abscess treatment is the trimethoprim. The most common cause of the death in the rheumatic fever would be the myocarditis. Which one is the falls rib? That is 9th. Next, the structure passing through the fossa ovalis is the greater saphenous vein. The PT replenish after antibodies used by giving the vitamin K. So that's all from this video. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.